lead to muscle disorders, to mental I mean, it's got consequences.
Her grandbaby diagnosed with an extremely rare disorder, only to find out the test done at the state's public health lab was a false positive.
And I started researching some things, and the more you research, the more problems you see.
Tonight, her mission to make sure no other family has to go through what hers has.
5 doctor's appointments and 5 weeks of worry and concern.
That is where we begin at 6. That grandmother wants answers, and she's not holding back.
She and several other families given false positive results for the same rare life-threatening illness.
News 4's Ashley Moss is here with details. Ashley.
That's right, a grandmother telling me the excitement of her first grandchild was dampened by the possibility of a frightening diagnosis, only to find out it was a false positive.
It can lead to muscle disorders, to mental I mean, it's got consequences if it's not handled quickly. So that's when the blood test began.
Shocking results from a routine newborn screening processed at the state's public health lab for a woman's first grandchild.
And how did you feel? I mean, you're hearing that the baby
may have a lifetime genetic disorder.
An out-of-range result from melanic acidemia, a condition so rare, only 20 to 30 cases are listed in the entire world. Janice's heart sank.
5 doctor's appointments and 5 weeks of worry and concern.
New results leading to relief, the family learning the baby never had the condition, but rather a vitamin B12 deficiency. Their relief then turning to anger and curiosity.
The more I researched it, the more red flags came up.
Janice filed an open records request hoping to find out how the false positive from the state's public health lab happened.
How many newborn testings do you do per month? How many are abnormal by what particular disorder? They said they didn't have that information available, which is quite a big red flag.
The grandmother candid with her concerns, sending a letter to several local lawmakers, wanting to know how one Oklahoma doctor has 6 to 7 patients flagged with melanic acidemia in just a couple months of time.
What can we do to keep other families from going through hell?
Now making it her mission to shed light for other Oklahomans relying on these tests.
How many more people are going through this, and what is it going to take to get it corrected?
As you may know, the public health lab sends many tests and screenings to outside labs. We've asked why they do that. However, this particular test was done in-house. We asked state health officials via an open records request to figure out how common those false positives are. They've offered us an interview on Tuesday. We're taking them up on that offer.
Oklahomans getting false positives on newborn genetic screenings, and some were thrown into panic mode, thinking their child has a rare genetic disorder.
My 2-week-old baby had a full blood draw done. They said, she could just be a carrier for this genetic condition, or she could have symptoms, and, it could be a lifelong process. And so you're just preparing yourself.
Now, since News 4 started investigating, others have come forward with similar stories. News 4's Ashley Moss is back on the story tonight.
He had mentioned that he's been a doctor for 30 years and he hasn't seen so many abnormal newborn screenings within the last year.
Sarah Panic says her baby's pediatrician told her not to panic at her newborn's abnormal genetic screen results from the state's public health lab, but she was afraid to tell family and friends.
Not having the answers, I just didn't have the courage to bring it up because I was scared. I would have been devastated. But I knew that I would do anything and everything for her.
The rare genetic disorder mostly affects boys and can be deadly. In girls, the disorder can still produce severe symptoms. Sarah says they pressed forward with another cheek swab and blood draw, later learning another retest was required, but she'd be the one who'd have to do it. The test sent straight to her front door from an independent genetic testing company.
I received a package on my door, and it was in my daughter's name, and it was a blood draw kit. Nobody had called me or anything. There was a huge lack of communication. If I wasn't on top of it, it would have been a bigger mess.
Data from a 2015 study done at Duke University indicates there should be 2 positive tests for every 100,000 tests done for the disease. And culling through Oklahoma data suggests inconsistencies. For example, if the Oklahoma State Health Department runs 50,000 newborn tests each year, it should only identify one case of XALD. And according to their records, the Oklahoma State Health Department detected 72 cases of XALD in just 1 month. 5 months after their ordeal began, the Panics learned little Lacey wasn't affected. This mom, while grateful, also echoing the same fear we've heard before.
Is this just happening in the state of Oklahoma? Is this happening in other states? I don't know. But I do think that parents should be worried.
Ashley Moss, Oklahoma's News 4.
In May, a bill was signed requiring the health department to bring the state in line with federal newborn screening standards.
For months, News 4 has kept close tabs on the state's public health lab. Everything from concerns about newborn screenings to questions over COVID variant testing. And more than a month after asking to tour that facility, today News 4 was finally granted access inside. News 4's Ashley Moss reports.
We've been consistently reporting about issues with newborn testing screenings here across the state. We traveled here to the public health lab today to get some of those questions answered. Leadership telling us today those abnormalities are all a part of the process.
Before the tour started, News 4 was told no cameras would be allowed for the first part of the tour, staff citing privacy concerns. One of the issues that brought us here, problems with newborn screenings, leaving some Oklahoma parents on edge recently.
They've had unusually high numbers from 1 month to the next. What's the explanation for that we can take back to parents?
So, first of all, we do have new equipment. We've relocated our lab and we've got new state-of-the-art equipment. So anytime you have different equipment, you might have different sensitivities within that equipment.
So the issues are with equipment?
Now, I'm not saying that the issues are with equipment. I'm saying the equipment is different equipment than what we've used in the past. So when you change equipment and do that like what we've done here, changing that equipment, then you may see a change in your abnormal results. Nothing that we're going to do is going to eliminate abnormal results that ultimately end up not being positive.
In December 2021 alone, 72 tests came back positive for XALD, a potentially fatal and rare genetic disorder. All of those tests conducted at the state's health lab. However, data from a 2015 study done at Duke University indicates there should be 2 to 3 positive tests for every 100,000 tests done for the disease. Remember, there are Oklahoma parents who were incorrectly told their baby had received a positive screening for a life-altering condition.
And we understand, again, that is, it brings on fear, it brings on uncertainty, and I wish that were not the case. But being a screening program, unfortunately, there's always going to be some of that that's going to have to occur, or else we're going to miss positive cases, and that's just a risk that we can't take.
The commissioner also saying they're working with lab partners and manufacturers to explain why those numbers were so high.
We'll continue to do that to get it down to the absolute minimum that is acceptable.
We also wanted to know about the lab's COVID-19 testing ability. According to the CDC, Oklahoma ranks near the bottom for variant testing.
Well, we're not 50 out of 50 anymore. If you look at the total numbers done, it's somewhere in that 30 to 40 range is where we're at now. So we made significant progress on that. We had some difficulties early on trying to get the data upload.
State leaders cut the ribbon on this $30 million health lab in January of 2021. At the time, it was considered state-of-the-art and was described as a front line of defense against COVID. When asked today about it, Reed said while there is a brick-and-mortar building for the public health lab, the much-touted pandemic center is more of a vision.
But the pandemic center itself, sounding like it is a physical structure and an operational building, that does not exist at this point. The pandemic center itself is a vision. It can be part of this building, but currently I can't tour you through the pandemic center because there's not the pandemic center.
As for that $30 million, Reed said it was used for the state's COVID response and testing. But Reed says there is a goal in place.
It's in planning. It's part of partnership development.
In Stillwater, Ashley Moss, Oklahoma's News 4.
The public health lab now has a permanent director. She was along for today's tour, but we did not receive clearance to do a one-on interview with her.
Panicked about newborn screenings.
5 blood draws, 2 catheter collections of urine, 5 doctor's appointments, and 5 weeks of worry and concern.
All of that worry, only to find out that nothing was ever wrong. Now this mom saying it happened to her not once, but twice.
There was still something, that wasn't right on her lab work, and we don't have why.
And that is where we begin here at 6. In both cases, families worried and waiting after getting what turned out to be false positive newborn screenings from the Oklahoma Public Health Lab.
News 4's Ashley Moss has been following the story, and she's joining us now with this new mom's worries. Ashley?
That's right. Since we heard from another family in a similar situation, we asked the health department for specifics on those screenings, including how common those false positives are.
I get a phone call from a case manager at OU stating that they think that she has another genetic condition and that her blood is having to be sent off again for further testing.
Abnormal results identified in required newborn health screenings for this family 2 different times.
And at that point, I was just so defeated.
First-time mom Maggie Pierce saying she and her husband missed out on enjoying those first few months of baby Eleanor's life because they were so worried. Turns out, she was perfectly healthy.
There was still something, that wasn't right on her lab work, and we don't have why. What happens in 2 months whenever I get a phone call again? When does it end?
Data provided to News 4 by the health department showed there were less than 20 occurrences each month in 2021 for one of the conditions Eleanor had abnormal results for, XALD. That's a genetic disease that affects the nervous system and the adrenal glands, except for the month she was born. In December of last year, there were 72.
Out of range or abnormal results does not mean that the child has the condition.
The health department tells us they performed screenings for all babies born in the state at their recently relocated Stillwater lab.
We are casting a net, and we want to make sure we catch every child that's affected.
We've asked for specifics about the number of out-of-range results. In a statement, they say the public health lab does not track false positives as the lab is not informed as to whether these disorders are confirmed in the newborn. The families we spoke to say that means they and state health officials are in the dark.
If they don't have the numbers, how can they have any oversight if something's going wrong?
Also saying the state owes families more data and clear communication.
A disclaimer stating there is a possibility that you could get a false positive result.
Once again, the state doesn't keep track of how many of those results are false positives. We've also asked for a breakout of the information we requested by specific disorder, and we're told this data does not currently exist in a shareable format.